everyone and welcome back to the second episode of the Infertility Files. I am Dr. Saloni Gandhi, Associate Doctor and Fertility Specialist at Gynac World, and as always I am joined by my mentor Dr. Duru Shah. She is the Director, Senior Fertility Specialist at Gynac World as well.
Hi Saloni, thank you so much for conducting this session. I think it's going to be extremely interesting and I'm really looking forward to it.
Ma'am, so the next topic today that we are going to be discussing is AMH, right? That is a very common doubt that all our patients are having today. We have so many women coming to the clinics feeling so overwhelmed because of the AMH report that they see. There are a lot of social media feeds on you can improve your AMH, if you have a low AMH you are becoming infertile, things like that going on. So can you enlighten us today about exactly what AMH is?
See, AMH is it's an acronym for Anti-Müllerian Hormone. So this is a hormone which is actually produced by the follicles inside the ovary, which are the resting follicles. You see, there are follicles which are active and which get released, and there are follicles which are resting, and they come after 3 months. Those resting follicles grow and then an egg is released. If you understand how the whole mechanism of ovulation happens, I can give you a sort of a brief background on what really is going on in the ovaries of a woman. When a fetus is inside the mother's womb, right, the ovaries of that baby are being developed, and in those ovaries are millions of granulosa cells, which are the cells which will then produce the eggs in future. These cells, as the baby grows, go on reducing in amount from 6 to 7 million whilst the fetus or the baby is in the mother's womb. By the time she comes out, that little baby, she's got only about 1 to 2 million eggs left in her ovaries. Now this AMH or the anti-Müllerian hormone is a hormone produced by those cells which are in the follicles. Each egg is surrounded by a sac with liquid in it, which is called follicles, Graafian follicles, and inside that is the production of this hormone, anti-Müllerian hormone. If the anti-Müllerian hormone is very high, it basically does not allow those eggs to grow. If it is very, very low, it just suggests that the amount of eggs left in those ovaries are very few. So it's got a different connotation with the reading. So when our women come to us and talk about AMH is low, and that's what they see on their report, because the report mentions that the fertility is low if the AMH is low, but they never tell you what happens when it is very high, right? So in short, AMH is a hormone produced by those eggs, by the follicles in which the eggs are there, and it circulates in the blood. So when you take a woman's blood, you will be able to evaluate that anti-Müllerian hormone in her blood. It depends at which stage of her life you pick it up. You pick it up at birth, you pick it up at puberty, you pick it up in adolescence, or you pick it up in adulthood. It will vary. When she reaches menopause, it will vary. So in short, it's a hormone which is reflecting the number of eggs left in that ovary in terms of, if you talk it about as a bank, the bank is getting depleted as it goes along and the AMH goes on reducing. It's just the quantity of eggs in that ovary which it reflects.
Ma'am, also I wanted to know if the quantity of the eggs is also going to determine the quality or not. For example, if I have a good AMH number, does that mean that I am going to have excellent eggs as well?
Not necessary. So AMH basically reflects the quantity of eggs and not the quality. Quantity matters because a woman needs more eggs to make more babies, right? But quality changes according to the age of a woman. If she gets older, as I mentioned in our last episode, age is the most important factor. But besides age, there are other factors which affect the quality of the eggs. So it is not only AMH. Say if a woman has got say diabetes, or a woman is obese or overweight, or if she has got high male hormone in her body or anything like that, it can affect the quality of the eggs, or if there is a genetic problem, or if she is a great smoker. I mean, it's so many things affect the quality of the egg, and therefore, AMH is only talking about the numbers, but not the quality.
So, ma'am, now when do we do this test? Is there a particular timing during the cycle that we need to do it, or can it be done anytime?
See, ideally it can be done anytime, but there is recent research talks about AMH being different in the premenstrual phase, means just before the period, and little different after the period. But still more or less it remains almost the same. It may be a marginal difference, but it is a good test to do because you can do it at any time of the cycle. Whilst if you do the other test, which is the FSH, LH and estrogen, what is the follicle stimulating hormone, luteinizing hormone and estrogen. Those are the three tests which talk about the quality of the eggs, and that is done on the second or third day of the period.
So, ma'am, when we are deciding on any fertility treatment, so we usually use other parameters also, right? So, you rightly named AMH, FSH, LH and E2. Any other investigations that we need to do which you feel are important as the baseline tests?
For a woman whose AMH is normal or not normal, we need to evaluate her otherwise for fertility point of view. We need to get her thyroid evaluation done because that affects her fertility. Almost 7% of our patients we find have got hypothyroidism. So, it is very important to test it. There is a prolactin hormone which comes from the brain, and that prolactin hormone is also responsible for preventing the egg from getting released from the ovary. So, there are various things which affect the fertility of a woman. It is not only the AMH which talks about the quantity, but it is also the other hormones which affect you. I want to come to a small thing about a hormone. A hormone is something which is released from one gland and it has effects on all the other glands. And the brain is the, what do you say, the maestro of this whole harmony of hormones, which makes a woman's period go normally. So, in short, there are many hormones which affect fertility. If we go into that, we will be talking for the whole day.
Okay, ma'am. Okay, ma'am. Ma'am, also are there any drugs or anything that reduce the AMH temporarily?
So, if you are a young girl who has been on oral contraceptives for a long time, you know, the oral contraceptives are hormones that are excellent. I mean, that is the magic pill of this century for a woman. I can assure you on that. It has so many advantages. But when you are on the pill using it as a contraceptive or using it for any other reason for a long time, maybe over a year, year and a half, 2 years, you will find that the AMH gets suppressed. It is something like, you know, the ovary does not need to make any more estrogen, it is getting ready-made estrogen, why should I work? So simple. So, in short, the AMH in such women, if they immediately do it after they are, whenever during oral contraceptive, while they are on therapy, and if they get their AMH done, they will find it very low. And then they are jumping out of their skin. They say, how will I ever get pregnant? But we must realize that that oral contraceptive has to be stopped at least for a few months before you will find the actual AMH. So, in short, this is a sort of a hint to young women who are on oral contraceptives. Please do not do your AMH whilst you are on the OC pill. Stop it for a few months and then do it so that you do not get alarmed. That is very important, and especially for a woman who is coming to us for fertility treatment. I think the doctor who is treating her must ask this question: are you on oral contraceptives? Are you on any therapy which will suppress the ovaries? So, these, when we do history taking, we have to have all these questions in place before telling a patient that, you know, your AMH is too low, you need IVF. First of all, if you asked me a question, does anything affect the level of AMH in the blood? Definitely, as I said, age is a major factor, but many other things affect. I think today's world, I would say smoking is a big no-no. smoking with women who are smoking more than 5 cigarettes a day affects their ovaries, affects the eggs and reduces their quality and gives them problems with fertility later. So, in short, when you are a smoker, a chronic smoker, then when you are sort of exposed to some kind of radiation, say for example, a woman is sitting with her laptop on her lap all the time for hours together, or she is using the phone hours together, she is keeping it on any contact of her body. When it is being charged, that is the worst time, that is to get the maximum radiation. But the more important is the radiation which occurs due to cancer treatment. If a young girl has had some cancer of the ovaries and she is asked to get surgery done or get radiation done, that radiation completely destroys the ovaries, depends on how much radiation, but the chemotherapy is even worse. So, in short, chemotherapy, radiotherapy are things which are a problem, and therefore, in such women, we tell them to freeze their eggs before taking the radiation or before taking chemotherapy. So, those women have to do it, they have no choice. Any pelvic surgery you do can affect the blood supply to the ovaries and reduce the number of eggs. So, we tell young women, if there is no problem, if you just find one small cyst in the ovary, a small fibroid, you do not have to jump into surgery. Think 10 times before jumping into surgery, talk to the experts, take maybe 1 or 2 opinions, and then you may do a surgery if it is really needed, especially if you are a young woman who needs to have children in future. So, these are the preventive aspects of reducing your AMH, because the more ovary you damage, the more blood supply you reduce to the ovary, those follicles die a natural death, and therefore, the AMH goes down.
Yes, ma'am. Now, coming to the favorite section of the whole episode, the myth busting part. In fact, first myth was rather a question that there are no modalities that can permanently reduce my AMH. Is that correct?
Permanent reduction of AMH is only after menopause, and that is when there are no more eggs left in the ovaries and you will have a very, very low AMH. The second thing is, if ovaries are removed, if there is a surgical removal of the ovaries, which are removed because of various reasons. Of course, there were in the past many people removed ovaries only because they were removing the uterus. They thought, oh, why keep the ovaries, no work of the ovaries, because there is no role the ovaries will play, because now she is finished with her childbearing. They thought that the uterus is the only function of the uterus and ovaries was to bear a child. So, in short, ovaries were removed out of ignorance those days, because we did not have all the modalities we have today, and there were many women in the past who had probably a low AMH, we do not know, but they went into menopause. So, in short, what you have to remember is that when it is nil, it can never be nil. It will always be sometimes undetectable, but it will not, there is nothing like a 0, because there is every hormone has a limit till which you can measure it. If you want to measure below that, then you have to go into very, very high tech equipment to get that information, which is used mainly for research. By the way, I just wanted to tell you that even young boys who are inside the mother's womb are producing AMH. So, which then does not come in later, but it is there, and it is a hormone which is actually against the Müllerian system. It's a very interesting hormone. Much later, next time we can talk about it, but it's a very interesting hormone.
So, ma'am, next question is, if I have a low AMH, does that mean I am infertile? I will never conceive. Is that
not at all? Again, I come to the same story. A woman who may have low AMH means she's got less number of eggs. But if she's still young and she's still age wise, she's got good quality eggs, even naturally she can get pregnant. We had one lady yesterday who got pregnant. So, in short, she came with an AMH of 0.4, right, and she had wanted to get pregnant, but somebody told her your AMH is very low, you will need IVF. She came for IVF. We said, let us look. When we evaluated her, we found she was having great eggs. She is pregnant just on her own.
Wow, that's really motivating, and in fact, it's very positive because we have so many women struggle with the fact that they have a low AMH or they have limited resources, and they tend to give up because nowadays AMH has become such a hype on social media where everybody is just saying that a low AMH means you need either IVF or you are probably infertile. Because it's not read correctly, people are not seeking help to read those reports, and that is where the problem arises, right?
Absolutely, you're right. And we need to get rid of those myths which exist, and that is how we, through probably giving correct information, will be able to help many young women to get over their anxiety, but rather instead look into how they can make things better for themselves.
Yes, ma'am. Ma'am, what about AFC? AMH is often related to a term called AFC, which is very confusing as well, because a lot of patients come with half scans, scans that are not giving us enough information to tell us what we exactly want to know from the ovarian reserve. So, what does that even mean, and where does that term stand in the fertility aspect?
So, AFC stands for antral follicle count. When you do an ultrasound, a scan for a woman, which is roughly done around day 4-5 of the menstrual cycle, which is the correct time to do it, you can count the number of eggs or the resting eggs you see in that ovary. And they would be on an average, depending on the age, like say if a woman is about say 25, you will see about 8 to 10 eggs in her ovary, each ovary. But as she gets older, the number of eggs which you see in the ovary, each ovary will be gradually reducing. So, that is called the antral follicle count, stands for AFC, and that correlates to the AMH. So, usually the AMH and AFC go hand in hand, and recently it has been said that if a woman cannot get an ultrasound done for various reasons, she may be in a place where there is no facility for ultrasound, but if she does the AMH, she will be able to correlate as to number of eggs in her ovaries. Okay. It will only talk about the number of eggs, it will not talk about her possibility of getting pregnant.
Okay. So, it means that if I am 40 years old and I have a AMH of 2.5 or 3, which is good for 40.
You need to celebrate then.
Yes, but does that mean that my children are going to be extremely healthy and I don't need to seek any fertility treatment?
Not at all. I mean, that's not right, because when you are 40, as I said, age is against you. You may have lot of eggs at 40, which we see in patients with polycystic ovaries. At 40, they will have a larger number of eggs compared to normal 40 aged women, but they will not have the same fertility potential as in a woman who's otherwise got is younger. So, a younger woman with less number of eggs will get better pregnancy rates as compared to this woman, unless this woman goes through an IVF cycle. Because she has more number of eggs, her chances per egg of getting pregnant will be higher than the one with the low AMH, but better quality eggs. Because she has got less number of eggs, her chances become less automatically, and here the chances are increased, because if you do a cumulative rate, you get a better final pregnancy rate at the end of say 6 months or 3 months, but not at the end of 1 month.
Ma'am, it has been a very knowledgeable session today, honestly, and because there has been so much confusion around AMH, AFC, and these terms are very loosely being used today. This session has, I am sure, made our viewers get a better clarity that AMH is something which is important today, but needs to be associated and well read with other modalities to understand where you stand in your fertility journey.
And that is the message which should go across.
We would be extremely happy to answer any of your queries on our Instagram, that is @gynacworldonline, or on our email address, that is gynacworldfertility@gmail.com. So thank you, ma'am. It has been very insightful. I think a lot of clarity has come on the topic of AMH today. So we will like you to join us again for our next episode. The topic for the next episode would be egg freezing. When, why, how? That will be all answered by Dr. Shah.
We'll be happy to join you.
Thank you so much and see you soon.
One tip I would like to give you before leaving. It's important for you to sleep well at night, almost 7 to 8 hours, because that is the time your brain will be resting and getting rejuvenated. Your brain is your maestro for all your hormones. It's the one who conducts the entire orchestra. And if you want your hormones to be in the right balance and in the right music and giving you the right fertility potential, you need to sleep well. Take care of your sleep hygiene.